one step, one bite each day. Healing steps to wellness, guiding you along the way. Body, mind, and spirit, stronger every day.
Welcome to Healing Steps to Wellness. I'm Dr. J.
I'm Mei.
Your trusted guide to whole person health, one step
One bite
at a
at a
time.
time. Okay, so
Morning,
Dr.
Mei.
Yeah, well, Dr. J,
Yes.
what are we going to talk about?
I have a few new patients in the last couple months, and they all came in with similar issues. And I was able to manage or work with them on some common treatment approach. So we're just going to talk about that. So we're going to talk about 333. Three common conditions I see, three common treatment approach I use, and
Can
get relief within 3 weeks.
yeah, simple.
Right. Okay. So the number one more common thing I see is heel pain. So when people talk about heel pain, and the first thing came to their mind was plantar fasciitis.
Okay.
But not all heel pain is plantar fasciitis. And people also like to say call it a heel spur. Now, even though research has shown that heel spur, the presence of heel spur doesn't equal to pain. But because on X-ray, people can see the heel spur and they can associate that with pain. So they should start with their mind that they had a heel spur syndrome. So, but there are different biomechanical things. We talked about that before, that it's not always the plantar fascia. The plantar fascia is the one that the big band coming from the heel to all five toes, the main support of the foot function, the foot structure. And when we stretch it too much, it gets inflamed, irritated, inflamed. That's why it called itis, plantar fasciitis. So that is the one. But a lot of time is because when we walk, when we land on the ground, we hit the heel first and then move the pressure from the heel to our arch and go to the front of our foot. And during this process, there should be a shock absorption function coming from your arch. That's why your arch should collapse and bounce back. So for people who have high arch, or because they have tight muscles, they don't have that much shock absorption. So when they land, when they walk, when the heel hits the ground, the pressure is too big, the force is too big, and there's not enough shock absorption. So actually, the pain is coming from the heel, soft tissue in the heel area. We call it bursitis. It's just like a cushioning right there. So it's really the number one thing is for me to look at what it is. Is it plantar fasciitis, is it bursitis, or Achilles tendonitis? It's inflammation of the tendon. So this number one category is from heel pain. And then the second one I see more common is joint pains, arthritis. Now, people always talk about the knee pain, but knee pain, unless you have a direct injury to your knee, vast majority of time, the knee pain comes from foot or ankle. You imagine that when you're not putting any ankle or your hip unless you're walking. Otherwise, there's no pressure in the joint. So when you walk, as I mentioned, that the pounding forces will come from your heel and your ankle to your knee and your hip and your lower back all the way up. And if your alignment is not good, your shock absorption is not good, you have extra pressure going up the chain to your knee everywhere. But at the same time, the force is not evenly distributed in your joint. And that's the reason why you start to have one area of the joint started to have the wear and tear, extra wear and tear. And that's how you wear down the cartilage and started to have those inflammatory responses to your joints. And so when people have any type of osteoarthritis, you can notice that it starts out from one side of the joint. It's not everywhere. It's just one side because the alignment is not correct. That's misalignment right there. So that's a very common thing that I see is joint pain, ankle, big toe, knee, like that. There's a joint pain. And the number 3 is skin, dermatitis. People usually have a dermatitis. They say, oh, eczema, it's just atopic dermatitis. We don't know why. So that's another common thing people have. And traditionally, we just say, oh, it's just dermatitis. Is number 1 thing is cortisone cream, and it will just go away. So that dermatitis is the number 3 that I usually see most common.
So, okay, help me. And I also have something to share with the audience that normally I like to have a conversation with people who call in to check on the treatment options for their pain. So when they mention about they experience the heel pain and they start talking more, most of them mention that they want to lose their weight. So it seems like a lot of people, they acknowledge that if they can reduce some weight, their pain probably would be eased or can be improved. So what is your take on this?
It certainly is a big factor, especially during the joint pain, heel pain. As I mentioned, that those are coming from the forces when we walk, and about 50% of the time, there's only one foot on the ground when we walk. That means almost 50% of the time, all your body weight is on one foot. Either right foot or left foot is 100%. And that means the more weight you have, the more forces you put on your foot and your joints, coming from your ankle, knee, everywhere is coming up. And so, of course, certainly, if the joints are built not meant for certain amount of weight, and you put that much weight there, you're overseeing the capacity of the joints they are meant for, and of course that will increase the deterioration right there, and increase more pressure, strain to your muscle on the heel and your tendons, everything like that.
And so also people mention about their arthritis. And we kind of remind people that Dr. J, you are foot and ankle, but also hand treatment that's in your scope of practice. A lot of the times when we see the sign of arthritis in hand and foot, it doesn't mean the arthritis only happen in these 2 area or one area. It actually affect the whole body. So
Right.
yeah. So how
So
do you help people?
if that's isolated one area, so for example, someone has injury to the big toe, injury to the ankle, injury to the knee, you have the osteoarthritis happening in that joint. That's isolated. But most people right now have the osteoarthritis that contribute that to old age. No, because it's wear and tear, and we call it old age arthritis. But recent research has found that osteoarthritis still has a lot of inflammatory factor inside. It's not just the wear and tear we see. So when a person has too much information inside the body, those inflammatory molecules will go to the joints over the body and accelerate that destruction of cartilage. So one sign they typically have is someone has multiple joints, osteoarthritis in multiple joints, knees, ankles. You can say, oh, this biomechanics. But when they started to have that in their hands, your shoulder, even the pain in their back, you have to consider it's a systemic. It's a systemic issue right there. It's not just the wear and tear of one single joint or two joints. So, but I also want to talk about that when I see the problems, my approach, there is usually is 4 steps. No, even though I talk about the 3 common things I ask them to do, but there's a 4-step approach I have. Number 1 is stop the pain. When you have the pain or you stop the itchy, being itchy like that, will stop the pain, stop the symptom, relieve the symptom right away. That's number 1 thing. But it doesn't mean that I need to go with steroid or go with a shock. So that is the different thing. And then the number 2 is find the root cause. So either it is the biomechanics or whether it's a systemic inflammatory responses or anything. We have to find the root cause. What caused it? Now, number 1, we treat the symptoms to make it easy for people to go on the recovery. That's number 1. And number 2, then we have to find the root cause. And then number 3, then now we can treat it. We can treat the root cause. But then number 4 is the most important thing is I want to build up the resilience based on the root cause. We can build on the resilience so it doesn't happen again. And so we stop the pain, release the symptoms, and then we find the root cause, we treat it, and then we want to build the resilience. So that is the approach I usually have when I see a new patient or any case.
So there's a process.
Right.
And yeah, so because the arthritis and well, we're talking about the chronic, the inflammation type of arthritis and also the pain. It doesn't happen unless it's an acute incident. Otherwise, they kind of accumulate for quite some time that our body cannot handle it and finally say, hey, I need your attention. That's why the pain occurs.
Right. But today, when we talk about 333, the first 3 is the 3 common things I see: those heel pain, joint pains, and skin dermatitis. So, but the second 3 is the 3 common things that I will ask my patient to do, and that's in the step 3. Under step 3, the repair and regeneration. How I ask my patient to do. What I ask them to do to relieve the pain and starting to have that repair regeneration process. And so there's 3 things. And so number 1 is physical activity. So when I talk about physical activity, it's not just go out to run, to jump, or like that. It's actually more of the stretching. Now, as we go into this mature process, or you want to call aging, our tendons, our muscles tend to become stiff a little bit. And not only they are becoming stiff, but at the same time, the 2 sides don't progress the same speed. No, they also go into the finding the root cause. The number 2, finding the root cause. But so when they do it, one side tends to be more stiff than the other. But when I do the treatment, I always ask them to do 2 types of exercises. Number 1 is stretching. Based on what muscles are stiff, we'll do the stretching exercise right there. And number 2 is strengthening. I ask them to strengthen their muscles. And a lot of time when they come in, especially younger population, like in their 30s, 40s, they always say, I'm very active. And I was like, okay, do you stretch? No. Okay, then we can do a stretch. And you are very active. What type of exercise you do? Oh, I do this, I do jump. And I say, how about your lateral, your side muscles? Your muscles prevent you from swaying from side to side. Oh, never pay attention to those muscles, right? So those muscles may not look very important when we're young, but as we get more mature to the age of 50, 60, when there's a higher risk of fall, those muscles are very important because If your body is swaying, you lose your center of pressure, your balance. But at the same time, if you trip over, we talk about the core muscles. The core muscles help you lift up. But if your legs are not strong enough, especially your side muscles, you just lean over and fall down. So it's not only reduce their risk, but at the same time, it's relieve their pain to make the joints, everything function better. So the side muscles. So those are the two exercises I ask them to do: stretching and muscle strengthening. So that's a physical activity. And number 2 is nutrition. So regardless which one we're looking at, they're all related to pain or dermatitis. And those are very highly related to inflammation. And if someone has leaky gut, if someone has a leaky gut, there are a few signs that a person has a leaky gut. And 2 of the signs, number 1 is actually joint pain. Longer than 30 minutes when you wake up in the morning. Just more than just a regular stiffness. That's number 1. Number 2 is dermatitis. So the food, I usually talk to them, the food serves several purposes. Number 1 is inflammation. The food we eat either induces or reduces inflammation. So we have to pick wisely what we put in our mouth. So the inflammatory food, the refined carbohydrate, sugar, dairies, highly processed food, even meat, and more protein that go into our gut. The microbiome turn them into TMA, trimethylamine, TMA. TMA goes to the liver, gut turn into TMAO, got one oxygen added to it, trimethylamine oxide. TMAO is very inflammatory, especially to arteries. So when your arteries are inflamed, your body just doesn't feel good. It affects the circulation, not only inflammation, it also affects the circulation, especially the microcirculation, the tiny vessels, arteries going to your nerve, to your joints, all those got affected much easier. So that's inflammatory food, as much avoid them as much as possible. And then at the same time, you want to increase your anti-inflammatory food. So dark leafy green, berries, to do that. But then the second part is the so-called short-chain fatty acid in the gut. Short-chain fatty acid is very important in stabilizing your metabolic health, reduce inflammation, but most importantly, the short-chain fatty acid is the one to repair your gut lining. To repair the gut lining, that means to heal or prevent leaky gut. So when we have the pain, when we have the dermatitis, we want to make sure we have the gut health, gut lining health, short-chain fatty acid. So those coming from fibers, resistant starch. That's number 2. And number 3 in the nutrition prospect is you need components of food for your body to heal your pain or your tissue, your tendons, like that, or your skin. And then the most important molecules in this healing process is collagen. People all hear about collagen. They even have a collagen drink. I had one patient coming in and say, I don't know what type of collagen I should eat. So I have all different types of collagen drinks I could find in the market. So I'm just like, okay, even you drink those collagen drink, the collagen still got degraded by your body into amino acid and then reassemble mature collagen fibers in your body to heal. So eating the collagen drink is just to make sure you have those components. It doesn't mean that they'll go directly to those injury sites. So that's where the important thing about the number 3, I talked to them about nutrition. In number 1, you want to have enough protein. There's collagen protein, but then the protein is plant-based protein because we talked about previously the animal protein will cause inflammation and also saturated fat. So plant-based protein. But number two is collagen. I usually call them, they are very picky molecules. So it takes 3 steps to create a mature collagen molecule. 3 steps. And each step requires something special. So that in the whole process, this process requires vitamin C, zinc, and copper. So vitamin C is easy. From our fresh produce, we got vitamin C. And patients started asking me, how much supplement should I take? I usually say, okay, step back. I want you to take them from food.
Real
So
food.
your zinc, copper from your nuts and seeds, pumpkin seeds, Brazil nuts, all that. That's where you got your zinc and copper.
Zinc copper.
Right. So that's another thing about the nutrition that I want them to do. And of course, another simple, so yeah, there's a lot of tricks we can do another nutrition. So, and number 3, and so we talk about physical activities, we talk about nutrition. And the next thing I usually ask them to do is check with them is their sleep. Sleep has a lot of things. You don't have a good sleep, you increase your stress, you increase your inflammation, and you increase your craving. When you have your increased craving, you tend to pick foods that are not good for you. Usually salty, sweet, and greasy.
Yeah.
That's what your brain is craving for. So that's a lot of things about a good sleep. And another thing is, when we talk about sleep, it's not just sleep itself. It's with so-called the circadian rhythm. When you are awake, you want to be awake. You don't want to be sleepy. When it's at night, you need to be sleeping. You don't want to wake up in the middle of being awake. So that's a cycle. Not only keep your information, and I mentioned about the collagen fibers being very picky. Turns out the 3 steps, the first 2 steps happen when we're sleeping. And the third step happens when we're awake. So if you don't have a good circadian rhythm, very good sleep awake cycle, it's harder for your body to make collagen to heal your injury or your pain or your skin. So that's very important. And for the sleep, I go by something. Usually go through their sleep hygiene with them. We call it sleep hygiene. That's what you do throughout the day, not just before, but throughout the day. How you build up the hygiene. For example, going out for the sunlight, taking a walk, like that. When you have your meals, and when you should have your last meal of the day, and what you should eat in the last meal of the day, so your body can be rested instead of being awake, because food will produce the neurotransmitters, going to your brain, doing those neurotransmitters that some will make you hyper. So you want to make sure you don't eat those food to make you hyper. Of course, going through coffee, that it's not that you don't drink coffee. I do drink coffee. So it's a timing, how much you drink and timing you drink. So all of that, the sleep hygiene I go over with the patient. So there's physical activities, nutrition, and sleep. 3 things I go with my patient. And usually they will be able to feel relief within 3 weeks. As early as 1, but most commonly about 2 weeks, they feel the difference right away.
That's amazing. That is, have you seen your patients are making faster progress by adopting your recommendation?
Yes.
Especially, okay.
Yes. People, I do see my patient making big progress. You mentioned about weight. When I go through this process with them, I don't talk about weight loss. But if they follow the process, even vast majority of them come back. No one say, I did great. Everyone came in and say, One day I just didn't do well. One day I had to cheat. No, no one was perfect every single day, but it's just vast majority of days they follow the rule. They know there was just isolated incident. They didn't sleep well. They didn't eat well. They couldn't go out to exercise whatsoever. That's isolated. But throughout the week, they stuck with the plan very well. Then they make good progress. For example, and sometimes they didn't even realize that. For example, one patient coming in after a month, she was talking about how she made progress here and there, and I asked them, "How do you feel? How about your GI?" I was afraid that it was increasing her fiber too much. She would have the bloating or any sign of that right there. And she told me, "Oh, I used to have pain on my right hand side at the stomach until I went to the bathroom. The pain would go away. But after I changed my diet, I didn't have that pain anymore. And my bowel movement was so smooth every day." And I'm just like, so basically, it just you just resolve your constipation.
Yeah, that's a bonus.
Right. And then they didn't really think about that. They didn't realize that it's just going through. No, we don't need to talk about, oh, we are working on this problem, we're going on this disease or any symptom. It just happens. And I track their weight. I don't usually tell them the weight. I don't usually do that. For example, one patient lost about 10 pounds in the past 6 weeks. And she didn't say, "Oh, I come in, I feel like I'm so light whatsoever," but it's 10 pounds gradually moving. But at the same time, there was another patient. Um, her weight didn't change. She didn't gain weight, but didn't lose weight. The weight was identical in the last 6 weeks. And then the investigator say, "Look, there's something wrong with your diet. You just didn't follow what you're supposed to." And she said, "Yeah, that's about it." So I don't talk about weight. No, that is not the primary goal, but it pretty much is like a side effect and also an indicator how good you are doing with
Right.
your nutrition.
Right. And and it's all connected, for the gut. You have a healthy gut through the great fiber for the children to allow the short chain fatty acid to work hard for your body. Uh, I think that play a huge um, factor to improve the mood health as well. So it's when we're talking about the root cause treatment, it it truly enhances our overall health as a whole person.
Right. So it's not the only three things I do. Um, it's the whole lifestyle. It's the where I will start because they are more impactful. I think that I can get more results, better results right away by working on these three. And it's
Mhm.
not a specific. It's not that I only which one will go first or which one is more important. Is usually is how I do it. Um, Especially a lot of time, in Midwest, people just like, no way, I'm not going to change my diet. I'm just not going to change my diet. Okay, sure, I'm fine with that. Let's go through other things first. Talk about your physical activity. Talk about your sleep, one step at a time until the patient's ready to make changes of the diet.
Yeah. So, um, so Dr. J, if anyone has any questions or they still not quite sure whether um, this approach will help them, what would you suggest?
Just call and discuss. There's no commitment when you call, and don't overthink it.
Yeah.
Sometimes people just overlook the simple solutions. That
Yeah.
they think that their issue is very complicated. Um, they need medication. They need this. They need that. But honestly, I have to say that I had more and more patients who came in because they knew I would not do surgery. I will not put them on medication right away. And if I do put them on medication, they are very accepted because they know it's really needed. I'm not just pushing them to get a quick fix. So that makes my treatment plan a lot easier, that I can stick to lifestyle medicine. Yeah.
Yeah. Wonderful. So yeah, they can reach out to us, send us an email that our website. They can submit a request. And also we have our email health@rochesterclinic.com or call us at 507-218-3095 and we will help them further from there.
Yep. Yeah. So that is a good information. Thank you, Mei.
Well, this is very helpful. So thank you for bringing this root cause treatment to benefit a lot of people. Not only they reduce their pain, but also your approach of helping them to prevent from recurring. That's so important. Not
And
only that,
some good side effects.
yeah, any good side effects. Yeah, good side effects. And that is truly win-win for anybody who come to see you.
Right. Yes. Well, great. Thanks for joining us on Healing Step to Wellness. I'm Dr. J,
I'm Mei.
guiding you toward whole person health, one step
And one bite at a time.
at a time. Thank you. See you next time.
Yeah.
Healing steps to wellness. One step, one bite each day. Healing steps to wellness, guiding you along the way. Body, mind, and spirit, stronger every day.